HIV pandemic and how important it is.
The Ministry of Health, in conjunction with health stakeholders, is cautioning the public over aimless use of antibiotics that may have dire health complications.
It really is a pandemic of this time, is when the bacteria or viruses or fungi, these are organisms that cause infection, when these ones change their structure so that antibiotics or antifungals can no longer kill them. So we say the bacteria has become resistant or the fungus has become resistant. And what does that mean for you? It means that if someone gets a pneumonia, which is a common infection, then the normal antibiotics that we use are not able to treat that person.
Infectious diseases specialist in the University of Nairobi, Dr. Lois Ombijo, warns that the trend of antibiotics abuse is leading to high costs for effective medicines.
Treatment or curative medicine is very expensive, and we have to think about how do we prevent disease so that we do not have to treat it. So when you think about community health promoters, when you think about the lower level facilities, what we call level 2 facilities, for example, these are the most important because they are where the people are. They can talk about issues of prevention, not just of infections, but of course of non-communicable diseases as well.
Preventive measures stand as the right module to fight antimicrobial resistance, with a projected 10 million deaths globally by 2050 if the trends do not change.
If we do not control how we use antibiotics, if we do not think about infection prevention, then we're walking to that very grim future. At this point already in hospitals, we struggle with treatment of multiple infections because antibiotics we have don't work. And we then have to reach for very expensive and unavailable antibiotics. So we must think about how to control antibiotic resistance now. Global estimates say that if by 2050 we have not controlled antibiotic resistance, then there'll be 10 million people dying every year from antibiotic resistance.
With high reported cases of teen and youth HIV infectious diseases infections in the country, the experts say it is individual responsibility to practice preventive measures aside partners' disclosure.
Hiyo stigma yenye kuko pale mtaani ikome, ndio watu wajue ukiwa unameza dawa yako vizuri na uko viral surprise, uko hiyo is equals to you, inamaanisha uweze ambukiza mwenzako.
So everyone has to take that. I'm protecting myself, I'm protecting other people.
HIV disclosure is a personal choice. Let people disclose at the time they feel ready and comfortable.
Reporting for TV47 from Naivasha in Nakuru County, I'm Willie Dennis Njiro.
We have to prioritize the one who are sick